everybody. I'm Vicki Liviakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We take your calls on the air live as well. We have with us today plastic surgeon Dr. Joseph Mele, backed by popular demand. We'll be discussing breast augmentation revision, as well as eyelid surgery, very popular surgeries. Later, we'll be taking your calls, answering any questions you might have. Here is the phone number, 800-440-4884. We'll also be posting the phone numbers to the doctor's office, so be ready to jot those down. And our caveat before we get started: any advice we give you here today, you certainly want a second opinion. Discuss it with your own physician as well. Welcome back to the program, Dr. Mele.
Nice to be here.
Breast augmentation. A lot of it is being done in this country, as well as
it's a very popular procedure.
Very popular procedure. You do revisions.
Yes.
And
with breast augmentation, I always tell my patients that if they're going to have breast augmentation surgery, they should plan on having another surgery somewhere down the line. Chances are good they won't need it, but at least if they've got that seed planted, if it comes up, it's not a huge surprise.
Now, when you hear revision, that would imply that there was a mistake made, or no?
No, this is without mistakes being made. It's just that the breast implants themselves are a man-made object, and they can wear out. Okay. So we can get into trouble with them deflating, or we can get into trouble with the scar around the implant becoming firm and either moving the implant or making the breast feel hard.
Is this a bad analogy? Is it like changing the tires on your car? You're saying deflating, there is a certain wear and tear?
They don't wear out quite like tires where they get rubbed flat, but they can wrinkle. And when there's wrinkling inside, if it continues to wrinkle, sometimes that area will fatigue and we'll get a hole in the implant, or we'll get a scar that forms around the implant, which is a normal thing. We want it to happen. It keeps the implant in place, keeps it from moving, because we want it to stay right here.
Sure, sure.
But if it becomes too tight or too thick, it may make the breast feel hard or actually push the implant around, move it to a different location.
Is that the material that we're talking about? Silicone, right? I mean,
silicone's very well tolerated. There's no allergy to it. It's just a normal reaction of the body to put a scar around something that's foreign.
Are some people's bodies, let's say, harder on the material than others?
Some people have a stronger reaction than others. Many women will have a soft, thin capsule, which is tough enough to keep the implant in position, but not noticeable. We call it a grade 1 contracture. It's something that you couldn't tell it was there.
Okay. Well, how do you know when you need a revision?
If it's causing distortion, so if one breast implant is suddenly rising higher than the other or moving in one direction, or we get a deflation, that's pretty obvious.
Do you actually swap them out? I mean, is it something that...
We do, and the two main manufacturers in the U.S. Actually have warranties on their implants.
Okay, so maybe the tire analogy wasn't that far off.
Not too far off.
But so, okay, so they have a warranty, and then you would, for how long? How long
the device itself is a lifetime warranty, so if the implant deflates or has a problem, it will be replaced. If it happens within the first 10 years, both companies also give money towards the surgery to have the implant replaced.
All right, so let's talk about how many breast augmentations are done in this country?
About 400,000 a year.
That's a lot.
Yeah, the last year we have real tight numbers on is 2007. It was nearly 400,000.
And how many revisions?
The revisions, probably about, now we're talking lifetime, probably about 25% will need some sort of revision, especially during the time period as time goes on. The first few years, less likely.
I mean, is this something that's just an outpatient procedure?
Yes. Yes, outpatient procedure. The primary procedure is an outpatient procedure, but it tends to be a fairly sore procedure because we're making a space for the implant. For the revision, the space is already there, and the revision surgeries tend to be something that you recover from quite quickly, like within a few days.
So downtime,
back to normal.
You build in a couple days, or
a couple days, yeah.
Bounce back. How does that compare to actually having the breast augmentation?
Probably more like a week. Although I do have patients who have surgery on Friday, they're trying to get back to work on Monday. They're sore, they can do it, but I don't recommend it. I think it's worth giving it a few more days.
You don't want to get out there and play tennis or anything?
No.
Not the first week anyway.
No kickboxing, that'd be bad.
Well, already the phone lines are lighting up, so we need to go to a quick break here, but for more information about Dr. Mele, you can call him 925-943-6353 or check him out on the web at drmele.com. And we'll be taking your phone calls, I promise. And we'll continue our talk about breast augmentation revision when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.